All right, hello everybody. I'm having a little bit of technical difficulty tonight. So, but I've got you guys in here. Let's see if I can now share my PowerPoint. That's what I'm struggling with a little bit. We're gonna get started hopefully here in a second. In the chat, can you let me know when you guys are taking the exam? Go ahead and put that in chat while we're waiting here. Okay. So, I'm sorry, I am struggling here because when I share my screen with you guys, the whole Zoom thing goes away. So that's a problem. Let's give me a second. Hopefully I can figure this out really quick. Dog's chewing a bone in here. I'm sure you can hear that. I'll have to kick her out of here in a second. Okay. All right, let's see. April, July, January, first to tip January. Okay, awesome. Okay. So, let's see if I can figure this out. Maybe I had it on the wrong view. Let's see. Okay, can somebody unmute and let me know if you can see the PowerPoint?
Yes, we can.
Yes.
Okay, thank you. So the problem is I can't see the Zoom. So for whatever reason, if you put something in chat, I'm not going to be able to see it, it looks like, or if somebody comes into the room, it doesn't look like I'm going to be able to let them in. So, but I can't figure that out. I don't know why. I've used this so many times. All right, but we'll get started. You guys are here and let's get going. So if you've not joined us for online office hours before, welcome. These are every Wednesday night, about 9 weeks or so prior to each NPTE. So this is the first one for the January, and it is being recorded. We will, we usually put them up on our YouTube channel within a week or so. If you want to see all of our online office hours, you would have to, we have like 21 or 22 of them. So you would have to start, several ones back. But again, they're all on YouTube. So you can look at those on our YouTube channel. All right, so tonight is strategies for success. So this is really like what's on the exam, what's the format, how do we develop a study plan, what are, how should we study, what are test taking tips, how do we analyze practice exam results, and then we're going to end with managing anxiety. So since I don't have the chat and I can't see that, if you have a question, I'm going to ask that you do unmute and ask your question. And I do not mind that at all. Please feel free to be doing that throughout the presentation. And then at the end, I will make sure we have time for questions as well. Okay, so let's go over the content and format of the NPTE. All right, so I think probably a lot of you guys know this, so I'm going to go a little bit quick. But again, if you have a question, let me know, or let me know if I need to repeat something. All right, so the actual NPTE is 225 questions, only 180 are scored. Why? Because 45 questions are on there to see if they're good items for a future exam. You won't know which those are, because if you did know which 45 questions didn't actually count in your score, you would skip them. And then they wouldn't know if they're actually good items or not. So even if you read an item and you think, ooh, this isn't a very good item, this sounds like a test item, it seems like a test item, I don't know that this counts. You know what? You don't know that. So do every question as though it counts if it's a real thing. The exam is 5 hours, and so you have to move at 45 questions per hour pace. You can go faster. What you don't want to do is go slower. If you go slower than 45 questions per hour, or you take more than an hour per section, you will run out of time by the time you get to the end of the exam, and we don't want to do that. There is a 15-minute break after question 90 or after section 2. It's the only time the clock on your computer stops. We highly recommend you take that 15-minute break. Get up, go out into the lobby, go to the restroom, get something to eat out of your locker, walk around, wake yourself up, and then get ready to do 3 more sections of 45 questions. Up to 40 questions will be scenario based, not 40 scenarios, 40 questions. I don't think you'll see 40 questions. This is something new. And so I do anticipate you won't have as many as 40. But basically what they're going to do is give you a mini case or chart review, and then you will have 2 to 5 questions associated with that scenario. All of those questions come together, and so you'll read the scenario, you answer all 2 to 5 questions, and then you'll move on. New content that was put onto the exam in 2024, regenerative medicine, as it relates to musculoskeletal and neuro. And so we've updated, if you have our review book, we've updated that in our review book. Telehealth, not state laws and rules around telehealth, but the concepts of telehealth. Interpretation of electrodiagnostic test summary results. So for example, if they give you the result of a nerve conduction velocity test, do you understand what that means? Gross motor development progression. Now, this one kind of blew my mind because I'm a peds therapist, and I'm like, what do you mean you added it? I always thought the developmental sequence was on the exam, but they say they've added it. So, okay, now we know for sure. I do not believe that you need to get in the weeds with the time frames. So, for an example, you might find one source that says infants sit at 5 to 6 months. You might find another that says 6 to 7 months. You might find another that says 7 to 8 months. Don't get into the weeds about that. Okay. Know approximately when the major milestones occur, but really what they're looking for is, do you know what comes first and then second and then third, and more of the progression. So I would concentrate a little bit more on that. And they've added negative pressure wound therapy or vacuum assisted closure. I don't think they're going to be asking you parameters for that. I think it's really, they want to see, do you know what that is and for what patients that would be appropriate for. What did they take off the exam? Not much. They took off phonophoresis. All right, does that mean you shouldn't know ionophresis? No, they said ionophresis is still on the exam. The other big change in 2024, videos. They have videos now. So the videos, what they suggest is when you get to a video question, you hit the loop button on the bottom right-hand corner, and then the video plays over and over and over again as you are reading the question, you're reading the answers, you're thinking, what to respond. The videos can be slowed down, they can be paused, they're short, and you do not need sound. Okay. Content, obviously, musculoskeletals are biggest, 27% makes sense. Neuros are second, 24%. So if you just look at those 2 things, that's over 50% of your exam. That's 52% of your exam right there. Then we have cardiopulm, lymphatics, other systems. I'm going to have another slide come up, so you don't need to write this down, but it's GI, GU, metabolic, endocrine, integumentary, systems interactions, like all those other things. And then non-systems is everything that's, outside the body, right? It's our research, our roles and responsibilities, our equipment, our modalities, ethical stuff, documentation. It's all of that is in non-systems. They break it down even further. 24% is PT examination, right? It's all your test and measures, outcome measures, special tests, normal joint biomechanics, gait, all of that, primitive reflexes, developmental sequence or progression, Ashworth scale. It's all of that. But look at the biggest percent, 32%, evaluation, differential diagnosis, and prognosis. Okay. Why? Well, because you're becoming doctors of physical therapy, right? And that's why it's such a big percent. So differential diagnosis, you guys know what that is. There are quite a bit of questions about that, okay? Prognosis, you know what prognosis is, but I think sometimes when we're studying, we skip over it a little bit. So I want you to stop as you're studying a pathology, and I want you to stop and think, what's the normal time frame of this? When would I expect the patient would improve or get better? Is it usually chronic? Can it turn chronic, or is it more of an acute issue? Is it progressive? Is it not progressive? So think a little bit more about prognosis as you are studying it. Evaluation, let's talk about the difference between exam and evaluation. If I give you a question and say, okay, here's this patient, what outcome tool would you use? And you pick the Berg. That's an exam question. You pick the appropriate outcome measure for that patient. But if I change the question and say, wait a minute, you did the Berg and they scored a 40, what are you going to do about that? That's an evaluation question. An evaluation question is, do you understand what the results of your test and measures or your exam techniques mean? So they want to see, do you know what a 40 on the Berg means? Oh, well, there's still high risk for falls. Okay, so based on that, I'm going to, I don't want them going home alone, or maybe they're not ready to go home, right? Maybe they need to go to skilled nursing or something like that. Almost 30% is intervention. Those can be somewhat difficult questions because if any of you have taken some practice tests, you know that you can get to a question and it says, okay, which of the interventions is most appropriate? And you read all four and you say, oh my gosh, I would do all four of those things with this patient. And you have to go back to the question. Is there something in the question that's pushing me towards one answer or another answer? What is the best? What's the most appropriate? What would be the safest for this particular patient in this situation? Where would I want to start? Okay. Now, I have a lot of students who struggle with these questions. I have a lot of students who tell me, I get it down to two answers and I always pick the wrong answer. And I'm like, well, first of all, I don't think you always pick the wrong answer. But what I tell students now is when you're studying, you want to study in a way that prepares you for these questions. So let's say you are studying interventions for adhesive capsulitis and you're reading, oh, well, I could do this and I could do that and I could do this and I could do that. Okay, I want you to stop then and I want you to ask yourself, if I could only do one thing, what would it be? What does the clinical practice guideline say? The clinical practice guideline says that corticosteroid shots is a level A. Okay, well, we don't do that. So what about PT? Okay, level B is patient education. And so stretching. But mobilizations and modalities are the level C. So if I could only do one thing, one or two things, I'm going to do the patient education and the stretching because everything else that I could do is a lower level of evidence, okay? So some students, I even tell them, maybe have a list, for this pathology, these are my top two interventions. For this pathology, these would be my top two interventions. And if you study that way, it'll help you with these questions. 6% is equipment, devices, modalities, technology, 8% safety, professional roles, responsibilities, and evidence-based practice. They break it down even further. Okay, so if you just look at musculoskeletal, you're gonna have about 16 in exam, 16 in differential diagnosis, about 17 in intervention, about 50 questions. All right, so if you look at lymphatics, all the way on the right-hand side, you're gonna have about 1 in exam, 2 in evaluation, differential diagnosis, 3 in intervention, about 6. Okay. Why is it important to know this? Because when you're studying, I don't want you to spend a lot of time on lymphatics because you're only gonna have 6 questions. But I do want you to spend a lot of time on musculoskeletal. Okay. My study plans, I'm gonna share those with you tonight. 27% of my study plan is musculoskeletal. Only 3% of my study plan is lymphatics. So you want to be smart about how you're setting up your study plan and how you spend your time. And that's where the content outline is helpful. This is that other systems, that one piece of the pie. I told you we're going to have another slide. Integumentary, about 9 questions. Metabolic and endocrine, about 5. Now, if you look at metabolic and endocrine, there are no PT exam questions. They're all differential diagnosis and intervention. You better know diabetes. That's an emphasis right here. Okay. Now there's other pathologies that fall in here, but diabetes is the big one. Okay. GI and GU. Wow, that's almost as big or it's just as big as integumentary. Why? Well, because we're doing a lot of pelvic health and some of it is considered entry level. And we treat a lot of patients that have GI things like GERD, right? We need to know something about it. There's also GI pathologies that could present like musculoskeletal, like a kidney stone. And we have to recognize that's not low back pain, it's a kidney stone, right? So that's why we've got a number of questions here. Let's look at systems interactions. There's no PT examination questions, no intervention questions, all 9 are evaluation, differential diagnosis, and prognosis. Okay, what are these? Systems interactions is any pathology, condition, intervention that affects multiple systems. And they want to see if you know that. Okay, so let's talk about pathologies that affect multiple systems. Diabetes, right? Cancer. What condition affects multiple systems? Pregnancy, obesity. What intervention might we do as a PT that it could affect multiple systems? Aquatics, right? So also on the exam when there's questions about depression, schizophrenia, bipolar, FND, they also fall in systems interactions, okay? So if you have our review book for therapy ed, that chapter in the big book on systems interactions is where you will find all the psychiatric, psychological, pregnancy type stuff, as well as oncology. All right, equipment and devices, technologies, 6 questions. How long could you spend just studying prosthetics? A long time, right? Well, we need to budget our time because it's only 6 questions. Modalities, this is decreased over time. Now it's only 4 to 6 questions. I want you to study it. I want you to get these questions right, but I don't want you to spend a huge time there. 6 questions in safety and protection. Okay, so what might that be? Body mechanics, universal precautions. Do you know safety as far as lines and tubes? Child abuse. Okay, those are those types of questions. Professional responsibilities is primarily, do you know your role as a PT? Do you know your scope of practice? And do you know the difference between a PT and PTA? Not state laws and rules, but the essential differences between the two. And then if you look at research, only 3 to 5 questions. Woohoo, right? Awesome. Years ago, it was like 12. So, we'll take the 3 to 5. So again, I have a lot of people that say, oh, research, I'm terrible. I'm going to spend a huge time there as I'm getting ready for the licensure exam. And I'm like, no. I want you to study it, but I don't want you to spend a lot of time for literally like 3 questions versus musculoskeletal, which is 50. Let's spend more time on musculoskeletal. Okay. All right. So the format of the NPTE, if you've taken any practice test, all questions have 4 answers, not 3, not 5, always 4. They don't say all the above, none of the above, A and C, B and C. They're all discrete, individual, plausible answers. Okay, so plausible. They won't make up anything that does not exist. So if you're reading a potential pathology in an answer, it's an actual pathology, whether you know it or not, but it's real. They won't make up something that doesn't exist. They will bold and capitalize words like best, first, most appropriate. Although they're not going to bold and capitalize all of your keywords, but they really don't want you to miss those. This test isn't to trick you. Okay, they want to see what you
Excuse
know.
me, I'm sorry to interrupt.
No, you're good. Go.
You're on slide 2. The slides haven't been moving.
Oh,
I don't know if you're able to.
let's see. Thank you.
Yep.
There's something funky happening tonight.
Thank you,
with
Hunter.
this.
I was trying to find the right time to chip in. Sorry.
Yeah, it's okay.
No, good. Thank you. Slide 2, you should have said something earlier. I know something weird is happening tonight. Let me see if I can. See if I can do it. I know, yeah, something's weird in the sharing thing tonight. I don't know why. Okay, what are you seeing now?
We're seeing the slide 10.
Does it say format of NPTE questions?
Yes, ma'am.
4 answers? Okay.
Yeah.
Okay. Do you see where it says there's a cross-out feature?
Yeah, we see that. Do you mind
Okay, perfect.
maybe we can move one slide up and down just to make sure that it's
Yes.
change, just so we don't have to stop you again?
Yes. So actually, when I go to the next slide, I'm going to let you know. And if it doesn't happen, you let me know.
Okay.
Okay, perfect. And I will put I'll have my email at the end. I'll also put it in the chat. So, we usually don't give the slides out, but there's not many people here tonight. I can do that for you guys too.
Thank you so
All right.
much.
So there is a cross-out feature. So when you know an answer is incorrect, you can cross it out. I suggest you do that. There's a highlighting feature. So if you're a fast test taker and you tend to skip keywords, I would highlight. There are minimal abbreviations. They don't use a lot of abbreviations because, again, this isn't a test to try and trick you, and it's not a test about abbreviations. So if you want to know what those 50 abbreviations are, go get the NPTE Candidate Handbook online. You can download it or print it. This is really important for standalone multiple choice questions. So not the scenarios, the standalone questions. They don't put anything into the stem of the question that doesn't matter. So if they add an age, it's there for a reason. If they add a time frame, a setting, it matters. Don't miss those keys. Now, people have struggled with this. Wait a minute. You're giving an exam to individuals to see if they can be a doctor of physical therapy in direct access environments, and you're only giving them questions with the information they need to know to answer the question in the stem of the question. People have problems with that. So what do you think happened? Scenarios. So when you get to a scenario, it's like a mini chart review. There will be extraneous information. Every scenario starts with an age, a gender, a setting. That may or may not matter. Okay. So what I'm trying to say is when you get to the standalone multiple choice questions, do not miss any word in the stem of the question. They all matter. When you get to a scenario, I want you to not miss any information there, but know that some of that information matters and some doesn't. And you're going to have to decide what that is. There are different levels of complexity. They actually ask item writers not to write spit back the knowledge, factual type questions. So the majority of questions you're going to see are, I have to know the knowledge, but I have to apply it in this particular situation or scenario. And then a high level synthesis analysis question is when you have to know multiple pieces of information to figure out how they fit together to answer the question. Okay. So I have some students who say, hey, Suzanne, if I memorize all the facts in the review book, I'll pass, right? No, you have to understand them. You have to be able to apply them. You have to know when to apply them. So make sure you're studying that way. Have somebody asking you questions. Ask yourself questions. Don't just study the facts. All right, can you guys see the next slide? And you're gonna have to unmute and tell me because I don't.
No, we're still on.
No. Okay. Can you see it
Yeah.
now?
Yeah.
Okay, maybe I'll just go this direction then. Okay. I don't know how many of you have taken the mini exam or if you know that it exists, but I highly recommend that you do that. All you have to do is put in Google NPTE demo or mini exam and it should come up. There's a PT and PTA exam. I would take both. Why not? I want to say there's 30 or 40 questions total with both. Why do I tell you to take this? Because the tutorial is the same for this as will be the day of the test day. So take the tutorial ahead of time. It teaches you how to use the cross-out feature, how to use the highlighting feature, how to mark questions for review. You know, do that ahead of time. Then on the day of the actual NPTE, when you're like, you know, got some anxiety and stuff, you don't have to worry about it. You already know. And it's just like another little practice exam. So why not, right? There's also 4 video questions and 2 scenarios. So I think it's just kind of a nice thing to do. When you sign in to take the exam, and by the way, you can take it as many times as you want. I've been in there numerous times. When you go to sign in, right as you sign in, look underneath the answer keys right there. Okay, so go in, take the mini exam, and then you can always go back and see, oh, did I get those right? Did I not? Okay. All right. Questions about that. Questions about the content outline, the format, how it's set up, timing, anything about that? Okay, so can you see the slide that says developing a study plan?
Yes.
All right, good. I think this is going to work. Okay, so a lot of students have a lot of questions about the study plan. First of all, you should have a study plan. Let's say you don't. Where do you start? How long do you spend? When should you move on? When do you take practice tests? It will actually increase your anxiety if you don't have a study plan. If you have a study plan, you follow it, you can check things off. It'll actually decrease your anxiety, okay? So we recommend that you need about 8 to 12 weeks prior to the NPTE. 8 weeks if you're really not doing anything else. 12 weeks if you're on your clinical as you're trying to study, okay? I know my students, and I think I saw one of my students online tonight. Thank you for joining. They're going to start studying at the end of their clinical. And then once graduation is over, they've got more time. So theirs might be like a 12-week plan. Okay. Start with your weaknesses. Why? We don't want to do that. We want to study the stuff we know, the stuff we like. If you start with your weaknesses, you will have lots of time to review, right? So you need that repetition. I'm going to start with my weaknesses, and every week I'm going to review it. By the time the exam comes, they're not weaknesses anymore. They're my strengths. If you leave your weaknesses to the end, what happens if you run out of time? That's a problem. What happens when the exam's getting closer and you're finally getting to your weaknesses? What's happening to your anxiety, right? It's increasing. That's not good. Why do we take practice exams? To test our weaknesses, to see how we're doing. So you want to start with the weaknesses, okay? Then as the exam's getting closer, now you're studying your strengths, the stuff you know, the stuff you like. It's making you feel pretty good because you do know it. And it's not, you know, that anxiety is not interfering as much. You want to do knowledge checks. So there's a lot of different ways to do them, but I'll just give you one example. Therapy Ed has a study pack. It's basically an online app with questions. So I might study musculoskeletal for 2 weeks, and then I might get on that app and say, okay, I just want to test my knowledge in musculoskeletal, you know, and I can do that kind of knowledge formative check. Or maybe I get together with my study group and say, hey, question me on everything in that musculoskeletal chapter. or I give my book to my mom and say, question me on this chapter, right? So that's good. But we also want you to take summative or full practice exams. We recommend 3 to 4 full practice exams. We do believe you should have a weekly review where you're getting in that repetition, right? You're starting with those weaknesses. We want that repetition to get it into that brain, to stick in that brain. We do highly recommend group studying. We definitely want you to get to everything on the content outline. We want you to get through that entire review book. There are students who fail by a very small amount or pass by a small amount. So it could be those 6 lymphatic questions that could get you over the hurdle to passing. So we want to make sure that you actually do that. So make sure everything's in your study plan. And I let my students do their plans together if they're going to study together, and that's fine. You can do a study plan with somebody else. Just make sure you consider everybody's strengths and weaknesses. All right, so Therapy Ed is the oldest prep company in the United States. We have surveyed students over the years, and we've asked, hey, if you've passed the licensure exam, can you tell us how much you studied? And the average student has told us they studied 3 hours a day, 6 days a week for 6 weeks. Well, that doesn't fit everybody, right? If you're on your clinical right now and you're trying to study for the January exam, you can't do 3 hours a day, right? Because you're in your clinical. So I did the calculation, it's 108 hours. So what I tell people is if the average student needed 108 hours of studying to pass the exam, then maybe your study plan should be at least 108 hours, okay? And that just gives you a nice guideline. So my study plans are 108 hours. Study by topic. Do not jump around from topic to topic to topic without fully finishing anything. That will increase your anxiety. You will feel like you've not accomplished anything. You don't have to finish musculoskeletal. I don't like musculoskeletal. I would not want to study it for 2 weeks, but I could study the knee, right? But I'm going to finish the knee, and then maybe I'm going to go to integumentary, or to a pediatric topic or whatever. But finish whatever that topic is before you move on, okay? Integrate sources, review books, your textbooks, your classmates, your faculty, Therapy Ed. Don't wonder about something, not be able to find the answer, and just say to yourself, well, maybe that won't show up on the exam. You don't know that, right? Find the answer, okay? Integrate your sources to find it. Don't just study by taking practice exams or questions. You don't want to do that. And when you do sit down to take a practice exam, treat it like it's the actual NPTE. Go to the library, shut off your phone, only take 15-minute break after question 90. Do it just like the actual exam, okay? Because one of the issues we know when you take the exam is your endurance. So a lot of people do good at the beginning of the exam, and towards the end, their scores drop because they're struggling to maintain focus. So you want to practice the endurance thing, okay? When you review practice exams, you want to obviously review the questions you got wrong, but if you have time, please also review the questions you got right, because maybe you were guessing and you got it right. It's good to see that, to review it and maybe read the rationale. That way, if that content comes up again, like on the actual NPTE, you're not guessing again. You have more confidence in answering, you know it at that point. All right. I don't like the 6-week plan, so I'm going to show you this one. All right, so this is my 8-week plan. And again, I'm going to give you my email at the end. And if you want me to send this to you in Word format, I can. So basically, this is 108 hours. There's a review every week. Those reviews might have to get longer, though. So maybe by week 3, it's 2 hours. Maybe by week 6, you're doing 3 hours. So because those should be building. So let's look at week 4. At the end of week 4, you have studied musculoskeletal, neuro, and 2 days of cardiopulm. That's what you should be reviewing at the end of week 4, all of that, right? So you need that repetition. These are building, all right? Now, again, I said you should start with your weaknesses. And that's why I like students to have this in a Word format where they can cut and paste it and put it back together. Because maybe musculoskeletal is your strength. Maybe you want to move that down to week 4 and 5. And you want to move neuro and cardiopulm up. Okay. The way it's set up right now is based on the content outline. So most of the questions, right, 27% are musculoskeletal. Then the next biggest section is neuro. Then the next biggest section is cardiopulm. So you could use it like it's printed here, because it's based on the content outline. But again, you can also move it around so your weaknesses are at the beginning. I did build in room for 4 practice exams, a day for you to review the practice exam, some final studying. The page numbers, those are page numbers. So CM is if you took our Therapy Ed 2-day course, you have a small course manual. Those are the page numbers. And if you did not, but you have our review book, our big review book, that's the SG, which is the study guide, and those are page numbers. Because what students told me works really well, take the chapter, divvy up the pages. I know if I can get through these many pages every night in those 3 hours, I'm on track to finish musculoskeletal by that second Wednesday. Okay. And so again, I can email you guys the updated one that has the updated page numbers as well. This is my 12-week version. So, and I know it's hard to see on here, but this is for people who are on their clinical. So you can't study 3 hours a day. So Monday through Friday, you're only studying 1 hour a day. And most of your hours and all of your review or all of your practice exams are on the weekends. So again, I updated this one. This one has practice exam 1 on a Thursday. I updated it. All the practice exams are now on the weekends. So I can send you the updated one. Maybe you're doing your clinical and you have Fridays off. Well, then I wouldn't study Monday, Tuesday, Wednesday, Thursday. I would do 4 hours on Friday, right? And so you can tailor this to yourself. So have a study plan. What I tell my students to do is get out a calendar. What are the days you can't study? What are the times you work? You're in clinic, the day you're graduating, whatever. Mark out the days you can't, and then start plugging hours in. Figure out when are you going to start? What are you doing? What are your strengths? What are your weaknesses? When are you going to review? And then are you studying in a group? We know group studying is extremely valuable. So figure that out. Maybe every Saturday for 2 hours at Panera, I'm getting together with my group, okay? And figure out your study plan. Okay, questions about study plan? Okay. A lot of students say to me, okay, I've got the study plan. I've got the book. I've got the page numbers. What do I do? Like, do I just sit here and read the book? Like, what do I do? Okay, well, let's talk about that. Know the goal of the session. Okay, tonight I'm getting through these 10 pages. Or tonight I'm studying wound care dressings, right? Or tonight I'm going to start anatomy of the knee, but know what the goal is, okay? Use a review book. It helps you stick to entry-level knowledge. I had a student not too long ago who said, I'm going to study from all of my textbooks and all of my class notes. I'm like, whoa, really? Like, how are you going to do that? Right? I mean, that's the beauty of the review books. It's short. We're giving you the information we think is most likely, and we're helping you stick to that entry-level knowledge. Reading and rereading does not help learning. I like that because I don't like to read. So, I mean, I like to read for, pleasure, but not textbooks. So I want to read it once and that's it. So I don't want you to reread the review book. I want you to read that musculoskeletal chapter once and not read it again. Okay. So what should we do? When you are reading through the review book, if you know it, don't do anything with it. Okay. I know that kids, when they're developing, they learn to sit independently around 6 months of age. I know that. Okay, good. Move on. If it's something that you're like, okay, I just read that. I get it. I know it. But that's something I know I'm going to forget. I know my hemoglobin normal range, but I know I'm going to forget that. Okay, so these are usually your factoids. Highlight it. I'm going to highlight it in my book. Then when you get to something that you're like, yeah, this is a difficult concept for me. I really don't understand mobilization of the spine. That's the stuff I want you to pull out and actually put on a study guide, okay? Why am I telling you this? A lot of students tell me they learn by writing everything down, and they're basically rewriting the review book. You do not have time for that. That is a waste of your time. It will take forever. You will not be able to do it. So I know it. I'm leaving it in the book. I know it, but that's a fact. I'm afraid I'm going to forget. I'm going to highlight it. I'm only going to pull out the stuff I'm really struggling with to put on a study guide so I can go ask my study group, or I can do a deeper dive into it. Okay. Then what do you do on the review sessions? Let's see if that's the next slide. Oh, okay. So then you have your review session on the weekend. What do? Hand your book to somebody. Can you quiz me on everything I highlighted? Okay, so you're getting, what we know is learning, constant quizzing is what helps learning, not the reading and rereading. Have you ever read something and you think, oh yeah, I know that. And then you say, oh, wait a minute. No, I wouldn't have known that. I know it because I just read it. But if somebody would have asked me, I wouldn't have known that, right? That's why the constant quizzing is so important. And then after you do that, here, quiz me on everything in this chapter that I highlighted. Okay, when you're done with that, hand them your study guides, the stuff that you're really struggling with. Can we talk through this? Ask me questions about this. These are the questions I have. Can you help me? Okay, and that's what's going to help with your studying. We want you to get to all different kinds of critical reasoning. So I'm going to skip over that. I think you guys are doing that as you go through the review books. Group studying is extremely valuable. Okay, I have listed there all the reasons why. This is why people don't like to group study. It increases my anxiety. Okay, but it's so valuable. How can we mitigate that? Talk to your study group. What are we going to study when we get together at Panera on Saturday? Oh, we're going to study primitive reflexes and developmental sequence. Okay, study it on your own first. Then when you get to that study group and you know it, and you can answer questions and you can teach it, that will actually decrease your anxiety and increase your confidence. So actually group studying can work in the opposite. It can actually increase your confidence. So study it on your own first, okay? And then you're going to feel much more confident as you go into that. The other thing people tell me is I don't like to group study because it's not efficient, okay? So use this Pomodoro technique. Say, okay, group, we're all taking this licensure exam. We need to make sure our studying is efficient. We cannot get off track and be talking about the movie we want to see tonight or the date we went on last week. So this is what we're going to do. Let's set a timer, 25 minutes. The only thing we can talk about is primitive reflex, guys. We're not going to talk about anything else. When the timer goes off, we've got a 5 to 10 minute break. Then we can chat. We can go get coffee. We can go to the bathroom, whatever. When that timer goes back, we're off. We're back to another 25 minutes of primitive reflexes and developmental sequence. Okay. So it can be very efficient if the group can decide on some ground rules. The other thing is, have you ever been studying and you're like, I don't understand that. And you go to look it up and 20 minutes later, you find your answer. What if you posed that answer to the group and somebody said, oh, I know that, and they explain it in 2 minutes? Isn't that more efficient? Yes. So group studying actually can be more efficient than studying on your own. All right, let's get to some test taking tips. I think that's probably what some people really want to get to. Again, read the stem of the question well. Missing one word could completely change the question. What are you being asked? Okay, that sounds easy, but I've made the mistake myself. I've read the question, I'm reading the answers, I'm thinking, I'm trying to decide what the answer is, and I'm struggling, and all of a sudden I look back up at the question, I'm like, oh no, it asked me which of the following is least likely. I forgot. or it asked me, what am I going to do first? I forgot. So it's kind of easy sometimes to forget the theme of the question. And so we'll talk about that in a minute. Identify your keywords. So maybe you want to use that highlighting feature. Okay, if you're a slow test taker, you may not, but if you're a fast test taker and you tend to skip keywords, I tell you, you should use the highlighting feature on every question. Read all the answer choices, obviously. Try and get it down to 2, right? If you get to a question and you're like, I have no idea. I don't remember having this in PT school. I have no idea. I'm just going to pick from 4. Try not to do that. What do you know? Can you get it down to 2? Very likely one of those is the right answer. Now you got a 50-50 chance of getting it right, right? So try and do that. Again, cross out answers if you know they're incorrect. That way, if you come back to review it, you don't even have to look at that. So what I suggest is you read the question, look at your keywords, maybe highlight them. What is the question asking? Read all 4 answers, cross out the ones you know are wrong, pick an answer, and then reread the question. Reread the question, reread the answers, verify your answer. Then decide, am I going to mark this question for review? If I have time, am I going to come back and review it, or am I good? Okay. And if you kind of have that, flow for every single question, I think it'll be good. And I'll give you an example. We just did comp exams, and I had a student take the comp exam in July, and the student didn't do very well. And I thought, a really good student. I'm really surprised. I thought they would have passed the exam. Student came back, took the second exam, blew it out of the water. And I said to the student, what happened? And the student said to me, I went back and reviewed that first exam and realized I was going too fast. I was skipping keywords. I wasn't reading well. I wasn't thinking through. I made so many errors that if I had just slowed down and reread, I would have done well. So this particular student told me that he read every single question 3 times. And I'm like, good. So he figured out it wasn't his knowledge. He just wasn't spending enough time with each question and rereading, and he realized that test taking error. Safety is your number 1 priority. So if you get it down to 2 answers and you're like, I don't know which one to pick, I'm ready to flip a coin. Wait a minute, this would be safer. That's a good test taking tip. Sometimes you'll read a question and you're like, oh, yeah, I would like to do all of these things. But one is more of a financial thing, one's more emotional, one's more functional, social. Wait a minute, this is a safety thing. I would do all 4 of these things, but you know what? The safety thing is probably the most important thing. Okay, so sometimes that helps you get it down to the right answer. The whole mission of the Federation is to protect the public, to make sure you're going to be safe. Okay. Again, they don't add extraneous information. They do in the scenarios, but not in the individual multiple choice questions. So, but you don't want to add extraneous information. So if you're this type of student, you read a question and you go, maybe they have stairs at home. Maybe they don't. Maybe they live alone. Maybe they don't. Okay. So if you tend to do that, I hope you can recognize you're doing that. And I want you to stop and say, wait a minute, could the opposite be true? Equally true? Yes. Okay, get it out. Get it out. Now, that's different than using your inferential reasoning. Let's say I give you a question on the NPTE and it says, the patient coming to you has multiple sclerosis. Which of the following is the best intervention? And you're like, wait a minute, that's all they said was MS? Like, how am I supposed to pick the best intervention? Well, you're supposed to know that typically their biggest complaint's fatigue, and hopefully you picked energy conservation techniques, okay? Now you might come back to me and say, but Suzanne, it didn't say they had fatigue. No, but you're supposed to know that the typical patient with MS, typically their biggest concern is fatigue. So I don't know that 100% for sure, but they're looking that you use your inferential reasoning and make a best guess that they would have fatigue, and then you pick energy conservation. Okay, so you can do that, but you don't want to add that extraneous information like maybe they have stairs at home, maybe they don't. We do suggest you mark questions for review if time allows you to go back. But if you go back and you say to yourself, I still don't know, don't change your answer. But if the light bulb goes off, oh, I get it. Oh, I made a mistake. Oh, I misread that. Oh, I missed that keyword. Oh, I didn't see they were a teenager. You have a really good reason, then change your answer. Research shows you will change it from the wrong answer to the right answer by a margin of 3 to 1 if you use this strategy. Okay, I'm gonna do this slide, then we're gonna see if you guys have any questions. Slow test taker, if you're slow, you've got to get down to that 45 question per hour pace. Otherwise, your computer will shut off. So practice with practice exams. Don't use the highlighting feature on every question. If you're a really slow test taker, it will slow you down, okay? But it's just practicing the pacing. If you're a fast test taker, is it a problem? Maybe, maybe not. That student I was just telling you about, he realized his fast test taking was a problem. And so he did something about that. If you take a test and you're a fast test taker and you're reviewing your results and you're reviewing the questions you got wrong and you're saying to yourself, yeah, I didn't know that. Yeah, I forgot that. Yeah, I didn't. That was so, I don't remember that. Then it has nothing to do with your fast test taking. That's knowledge, right? But if you're reviewing your exam and you're doing what my student did and saying, oh, that was silly. Oh, I shouldn't have done that mistake. Oh, I missed that. Oh, then you're going too fast. So use the highlighting feature on every question. It makes you slow down. All right, any questions about that? All right, we only have 2 sections left. And I know I'm probably going to go over a little bit, so hopefully you can hang in and ask some questions. I'll give you my email here. Okay, so when you analyze your practice exams, obviously, again, review the ones you got wrong. If time, review all them all, okay? Ask yourself, why did I miss it? Was it because I only studied the facts? I didn't really understand it? Okay, I'm going to change the way I'm studying. Is it I missed something? Why did you miss it? Were you reading too fast? You know, were you just skipping over keywords? Why did you miss it? Okay. Maybe you picked the a correct answer, but it wasn't the best answer. Why? Read the rationale, figure that out. Okay. Were you just second guessing yourself and changing answers willy-nilly versus I still don't know, I'm going to leave it alone versus the light bulb goes off, right? So maybe fix that. Did you add extraneous information? Well, maybe they have stairs at home and that messed you up. Okay, if you can figure out why you got the question wrong, it tells you about how you should study or how you should take your strategies for taking the test or reading questions in the future. You will increase your knowledge by reviewing the questions, okay? And then decide, do I need to adapt my study plan? Do I need to change the way I'm studying? Do I need to change my test taking strategies? Some students tell me I'm a very slow test taker. I do not like to mark questions for review. I spend a good amount of time on each question. I'm not going to mark questions for review. I'm not going to go back and review. Okay, let's make sure that works for you. Take a practice exam, do it that way. Look at the ones you got wrong. Would it have been helpful if you'd gone back or not, right? So learn more from your practice exams than just the content. Okay, what are your strategies? That student learned he's got to read the question 3 times. He's got to use the highlighting feature on every question. And he did mark questions for review and went back. Totally changed the way he was test taking because he learned from the first time. When you're reviewing your scores, are your scores going up with each exam? Now, your total score might go up. That's great. But I really want you to look at what have you studied? Well, I studied musculoskeletal and then I took a practice test. Okay, what'd you score on musculoskeletal? That's more what I'm concerned about. Then I took my second practice test and I had studied musculoskeletal, neuro, and cardiopulm. But look, I did horrible in other systems. Yeah, but you haven't studied that yet. How did you do in musculoskeletal, neuro, and cardiopulm? Well, I passed that. Great. keep going, okay? So really focus on the stuff you've already studied. All right, I do want to show you this. I highly recommend that as you take practice exams, you log your scores in chronological order and you look for patterns. Most students who meet with me tell me, I feel all over the place. I don't know what to do. The exam's coming up in a month and I don't know what to do. And I'm like, okay, let's look at your results. And we put them like this. And I'm like, wait a minute. Your score has been going up consistently. In the last one, you almost passed, you only missed it by 1 point. Look at interventions. You pass that every single time. That's a strength. Cardiopulm, that was your 2 lowest scores twice. That's a weak area. Okay. And so when you put them side by side and you start looking at them, and here's the thing, the green is stuff they passed. So look at the first practice exam. They only passed interventions. On the last practice exam, they passed what? 1, 2, 3, 4, 5 areas, right? And so they're increasing, you know, they're looking better, right? So this is an example from an actual student of mine. I do also want to point out, look at lymphatics and integumentary. I made those red. Do you see on the first Pete, they got a 71% and it was a 501? And on the last Pete, they got a 71, but it was a 622. Okay, I do want to explain this. When you take the Pete and the NPTE, the percents do not tell you if you passed or not. The percent tells you how easy or difficult the questions were. So a 600 or higher is passing. So for the first practice Pete, the student got a 501. They were 99 points away from passing, but they got 71% correct. Those were easy questions and they should have gotten more questions right to get to that 600. On the retired Pete, they scored a 622. They passed it, still was 71%. Those questions were harder, so they didn't have to get as many right to get that passing score. So what am I telling you? When you take the Pete exams, don't look at the percents. It's really hard. Look at the scaled score. Did you get a 600 or higher? That tells you if you passed or not the percent. And again, I can help with this if you need help with it. All right, really quickly, and then we're going to wrap up. Managing anxiety. Have a study plan. Maximize your study time. Seek help on campus. If you have struggled with test anxiety all the way through school and you never sought help on campus, get it. Make a test drive to the Prometric Center a couple weeks ahead of time, maybe. You don't want to get lost that day. Maybe go in and talk to the person at the testing center. Hey, I'm coming here in a couple weeks. I'm going to take an exam. Just want to see where the bathrooms are. Wanted to ask some questions. Believe it or not, your anxiety will be less that day because you know where you're going, you know your surroundings, you know what's going to happen. Keep a positive attitude, okay? If you keep saying to yourself, oh my gosh, I'm never going to be able to study this. Oh my gosh, I do poorly on exams like this all the time. I always guess the wrong answer. You are increasing your anxiety yourself, right? So don't do that. Tell yourself positive things that will help. Arrive early the day of the exam. Do some deep breathing. You are allowed to write things down as soon as the exam starts. You'll have 2 dry erase boards that day. What I tell people is it's okay to do a brain dump, but 5 minutes max, that's it. I don't want you to spend a long time there and then you're running behind. That can help with anxiety. I'm going to write down my sensitivity and specificity stuff. Now I feel better. When that question comes, I've got my answer right there. Okay. Maybe it's lab values. Maybe it's, you decide. Write something down. Okay. Watch your time. Make sure you don't get behind. That's going to increase your anxiety as well. All right, so what do we have as far as resources? If you haven't taken our 2-day prep course, you can take it online or in person. You do get that course manual, that small like Cliff Note book. We do have a review and study guide. That's our big book. It has 3 practice exams, full practice exams that are online, and you get the code in the back of the book. We do have the new app. It has 600 questions that are different from the questions or the exams in the book. So you can do that. And then the nice thing about it is the app is you can tell it what you want. I want 20 questions today on cardiac eval, and it pulls them up. Our online office hours. Okay. The other thing that we have that's brand new is we do one-on-one tutoring. And I'm one of the tutors. So if you want one-on-one tutoring, you can sign up for that on our website as well. Okay, so here's the schedule for the rest. If you're taking it in January, here's the schedule. Yeah, we're not going to do it on Thanksgiving and Christmas Eve and New Year's Eve. That's why we start a little earlier than normal. I do want to give you my email. It's right there. So please jot that down or take a picture. Email me if you want the PowerPoint or you want my study plans, or you have any other questions. All right, I went 2 minutes over. Sorry for the technology issues. But what questions do you guys have?
I have a question.
Yeah.
Firstly, it was so insightful to hear that focus on weak areas first, because I actually started with areas that I'm good at, just to make myself like feel like, oh, I can do this. But now
Yes.
that I see that, oh, I'm pulling myself into anxiety closer to the exam because I would have less time to study. So thank you for that so much. You saved me.
Sure.
My question is, I have the recent study guide and I am following that. But when I look at my O'Sullivan, I feel like there's a lot of information that's not presented in the study guide that I feel like is going to be very important on the exam. Like maybe there's a question that comes in the exam that was somewhere hidden in all this big book, and I find myself reading the chapter like I'm reading SCI right now, and then I'm getting overwhelmed with like, oh my God, there's this entire book and this is just neuro at the moment. So what do I do for that?
So you're using, are you saying you're using the review and study guide plus the O'Sullivan book? Is that what you're trying to tell me?
Yes, to consolidate any knowledge that was not that is not in the study guide that I
Yep.
am fearing in my head is that I need to know, and I would fail if I don't study the whole chapter.
Okay, so you got to get over that. I'm gonna, the perfectionist thing, but I still would use a review book as a guide, right? So I would try and get through the chapter in the review book first. And then I think O'Sullivan's a great book. I highly recommend people have that as they're studying. And I would use that as your reference. So I'm studying spinal cord injury in the review book, and something comes to mind that I want to know more about, or I don't, I don't remember the details, maybe a little bit. I know there's details to this that I'm forgetting. Then I would go and I would look it up, but I wouldn't be reading like through it in its entirety. I would just be using it as that resource to just look up the things that you're not sure about.
Okay, that makes sense. Thank you.
Yeah. So I recommend the O'Sullivan book if you have it. Every question on the NPTE has to be referenced from a textbook, and hers is used a lot. For musculoskeletal, and I don't want you guys to go buy anything, but if you have the Dutton or McGee book, you're fine. If not, it might be something you can get from the library or whatever. But our review book pulls a lot from Dutton and McGee. Those are used a lot on the exam as well. Other questions? Oh, the audio quality was poor. I'm so sorry. Oh, it was clear on somebody else's end. Okay, this would sound like it was one person. Okay. I'm going to put my email into the chat because I know I don't have that up anymore. Any other questions? Let me know.
I have one question.
Otherwise, yeah, go ahead.
I have been asking a few people, because I know Therapy Ed and all the videos I've watched, there's a lot of focus on the clinical practice guidelines. But few resources, they say that it's not important to know that for the NPTE. So I'm a little, again, conflicted in
Yep.
that area. I do like like in the class today, you mentioned when it comes to frozen shoulder, how to come to
Yes.
the best decision when you're
Mhm.
split between two choices. And I feel myself always at that road where I'm like A or B. And
Yes.
CG does help there, but yeah, some people say it's not necessary to. So what
So
do
here's the thing about clinical practice guidelines. If a clinical practice guideline is fairly new, you want to ignore it. All the NPTE questions have to come from PT textbooks. If a clinical practice guideline has been out for a while and it's made its way into a PT textbook, it is fair game for the exam. They may not state it like that. They're not going to say, per the clinical practice guideline, da 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 da. But they might say, you're treating a patient with adhesive capsulitis. Which of the following would be the best intervention based on evidence? And they would want to see that you knew it's patient education or stretching and not ultrasound, right? So in the Therapy Ed book, review book, what we have done is any clinical practice guideline we think you need to know, we've put like in a little box with the key things that we think you need to know. And that they are helpful because adhesive capsulitis is going to be on, right? I mean, some of the clinical practice guidelines, there's stuff we see all the time. And so the pathology or whatever is going to be on there. What does the clinical practice guideline do? It tells us what's the best. And that's what the questions are going to be asking you. What's the best, special test to do with this? What's the best intervention here? And the clinical practice guidelines are telling us that. It's not going to be worded that way. What does the clinical practice guideline say about this? Or it's not going to be asking you like, what's a level A, what's a level B? It's not going to be worded that way. So I would say, yes, you are going to see them, but you're not going to see things that haven't been out for a while. There are things that have been out for a while that there are common things that we see that have made it into PT textbooks and are in the review and study guide.
Thank you.
You're welcome. Other questions you guys have? I know I kind of went quick and I was a little fuddled up tonight because of all the technology issues. My computer is not connecting to the internet. And I had them fix it today and I came home and it was broken again. So I'm on my husband's computer and it's, not doing the Zoom the right way. So,
I actually do have a quick question for office hours. Are those specifically just for like questions on certain topics, or are they actually like full on review sessions and
So the rest of the online office hours are reviewing a topic.
okay.
And each person does them a little differently. Some people will present and then they're going to give you like 5 to 10 questions at the end and see if you can answer them. When I do them, I have you answer a question. We go over the question, do some teaching techniques, go to the next one. Some integrate scenarios. So it's not all lecture like tonight was. There is more you testing your own knowledge. All of them do have exam simulated questions embedded. We just do them a little differently. But it is also an opportunity for you to come on and ask questions about that topic.
Okay,
So
thank you.
I can't remember what next week is. Next week is neuromuscular pathologies. Yeah. Yep. And Dr. Schaefer is really good. So yeah, this is the only one where it's really us talking the whole time. Otherwise, they're mostly, we do provide questions and answers and work through actual questions. I'm going to stop the recording.